Well, in the work that we do with kidney patients, with those on dialysis, with those that have received or are waiting for a transplant, it's such a delicate balancing act to get the patient stabilized. Kidney patients suffer from a lot of different conditions, and they take multiple medications, and they respond very differently to those medications. And it takes a long time for a healthcare team to stabilize a patient. Once they're stabilized, absolutely any alteration in that treatment regimen can affect their health, can throw them into a tailspin, and particularly with transplant recipients, if a patient fails that's on anti-rejection medications, it means that their organ has failed. And we don't want that to happen because then it puts them back on dialysis, and that's a much more expensive treatment on the healthcare system than stabilizing a patient that has received a transplant. Well, the optimal result, of course, is that they stay stabilized, that there's no alteration in their treatment mechanism, that they're able to have the medications they need when they need them. To force a doctor, in case of kidney patients, a nephrologist, who already has a huge patient load, and there aren't enough nephrologists to treat the number of kidney patients that are out there, to force that doctor to have to pick up the phone to go through a prior authorization or to have to switch a medication that's been working for a patient, it's just ludicrous. We're talking about people that are sick. We're talking about people that have multiple things going on with their health. We're not talking about people that have access to private health insurance. We're talking about people that are on Medicaid. So it's a very vulnerable population. And to add a burden to them where they are already dealing with so much that can ultimately affect their health is just ludicrous. It's ridiculous. To stabilize them, to keep them stabilized, it keeps them functioning, it keeps them healthy, it keeps them out of the hospital, and ultimately it costs our healthcare system less money to treat a stabilized patient than it does to force that patient to jump through hoops through different treatment regimens just because they're going to save a few dollars now, where in the long run it's going to cost more money.